We are 1 week into the Medicare Annual Enrollment Period. Let's talk about the Inflation Reduction Act and specifically the $2,000 out-of-pocket cap for Medicare beneficiaries on their Medicare Part D drugs. Is it helping some people? Yes. Is it hurting some people? Also, yes. Why? When the Inflation Reduction Act was written, they capped drugs for each beneficiary on Medicare for Part D at no more than $2,000 out of pocket starting January 1st, 2025. All the extra financial risk is shifted to the insurance companies. Now, what they didn't write into the law is that the insurance companies have to keep covering all the same drugs that they cover right now. So as an unintended consequence, but one that I think was about 1,000,000% predictable, the insurance companies are not going to cover a lot of the expensive drugs that they have been covering that they don't have to cover. So what's happening is when we run quotes for people who have some of these drugs that are very expensive, this year for those drugs, I have one person who paid about $1,400 over the course of the year. And in 2025, the estimate for the same person for the same list of drugs is $205,000. Why? Because no Part D plan in this person's area covers the medications anymore. This should have been thought of by our members of Congress before they passed this legislation. That it wasn't, I don't know what to say. Anyone with half a brain could have seen this coming. So the point is, this is not the year to ignore the annual enrollment period. If you're someone who has just let your medications and your Part D plan, your Medicare Advantage plan, just roll from one year to the next, you can't do that this year. A lot of plans are leaving the market. A lot of costs, even on covered medications, are going up for next year, again, to cover the financial risk from that $2,000 cap. So do not let December 7th come without you having looked at those 2025 plans and run quotes. If you have an agent or a broker, that person should absolutely be doing this for you. If you don't, you can go to medicare.gov, your local state health insurance program office, or you can call an agent or a broker. If you have Medicare questions, give me a call. My name is Tabitha. For the last 18 years, I've been helping Medicare beneficiaries find the right coverage without paying too much. Like and follow for more.